Hi, I'm Monica Laronda. I'm a professor at Lurie Children's Hospital um, in Chicago and Northwestern University. I am the current basic science chair for the ENDO 2025 annual meeting here in San Francisco. So the trends that we're seeing at ENDO 2025 is probably not surprising, but along the lines of obesity, especially with the increase of GLP-1 drugs. And but of course, because we're the Endocrine Society, we're looking at new um, emerging research in this field, how it might affect puberty, the onset of menarche, and chronic health in individuals that have increased BMI, increased adiposity, or variations in their genetic makeup that maybe impose them to or induce some of these mechanisms. And how this affects their life overall. I'm personally really excited about the abstract presented by Dr. Jin Hu, who's a trainee in Professor Barbara Cohn's lab at Emory University. They're going to be discussing the transmission of environmental health and the rise of the cross-generational effects and how this might affect age at menarche. So again, this is extra environmental influences on puberty development and menarche. One of the Meet the Scientist sessions is going to talk about serendipitous discoveries of sex differences in research. And so this one's going to be given by Dr. Cha, and she's from Vanderbilt University, and some of the discoveries that she's made in glycemic phenotypes, she happened to find differences in male and female mice. And so this one will be just an exciting way of describing how to collect and analyze this data as sex is a biological variable. And I think it's really important, especially in this climate, to remind people that these are important differences that should be studied and realized, because it really does help us understand not just the onset of disease, but how to treat these disorders. And often these are quite translatable into the human population.
My name is Shellsea Portillo, and I'm a newly graduated endocrinologist from St. Louis University Hospital in St. Louis, Missouri. We conducted a retrospective cohort study of 234 adult men treated with GLP-1 based therapies, including Semaglutide, Tirzepatide, and dulaglutide. 79% had diabetes, and baseline BMI was 36.5. We reviewed charts of men who had total and/or free testosterone levels measured before and after treatment, and who were not receiving testosterone supplements. The background is that obesity and type 2 diabetes are associated with low testosterone, often due to central suppression of the hypothalamic pituitary gonadal axis. It is known that weight loss improves testosterone levels, and GLP-1 therapies are widely used for weight reduction in patients with obesity and diabetes. With therapy, patients lost about 10% of their weight, and A1C improved. Total and free testosterone improved significantly, and the total proportion of men with total T greater than 300 nanograms per deciliter increased from 54 to 76%. That means we had an absolute increase of 22%. We observed a significant inverse correlation between weight loss and change in total testosterone, but the number of subjects with repeated free T measurements was limited, raising the possibility of a type 2 error. These findings suggest that GLP-1 based weight loss therapy may not only improve metabolic outcomes, but also bring testosterone level back to a normal range in men with obesity or type 2 diabetes. This could offer a non-hormonal approach to improving testosterone in a specific population where low T is often due to weight-related suppression of the hormonal ACEs. As for next steps, the current study was retrospective. and while it was a clear association, more research is needed, ideally prospective trials to confirm these findings. This study was not designed or intended to support FDA approval of GLP-1 receptor agonist as a treatment for hypogonadism. However, these findings open the door to future research.